All right, so Dr. Michel, our first question is for you. Why were seniors and frontline workers given top priority to be vaccinated?
All right. So, well, let me introduce myself a little bit.
So Dr. Michel's presentation is going on.
Yeah, is Leah starting? What's it here down there?
Can you mute yourself?
I haven't seen it.
All right. My name is Michel. I'm in internal medicine. I practice in the North Philadelphia area. So, Leah, thank you for this opportunity. The question you asked, it's a good question. The whole thing is resources are always limited. So when resources are limited, you have to do some sort of priority. You have to allocate your resources to where they are needed the most. So in this situation right now, the people, I guess you have to start with a healthcare worker. The reason you have to start with the healthcare workers is because if they get sick, then they won't be able to take care of the other people. The other issue is people from the nursing home or older people with underlying issues, they are the most likely to get, if they get COVID-19, if they get infected, they are most likely to get the severe complications from the disease. So hence, that's the reason you start giving the vaccine first to healthcare workers, because you want to keep them healthy. If they get the vaccine, then they won't be out of work for too long, or they won't have the severe case. I mean, it would reduce the severity of the disease. That's why you start with them first. And because you don't have that many, I mean, at first we didn't have that many vaccines either. So that's the reason.
Okay, thank you. And why should we get vaccinated as staff members in long-term and short-term care?
Well, the issue with vaccination is always a good thing. What happened with vaccination decreases the severity of the disease. For example, any vaccine, for example, even with flu, if you get a flu vaccine, getting the vaccine doesn't mean that you won't have the disease. Some people think that, okay, I get the vaccine, then I won't have the disease. It doesn't put you in a bubble. You can still have the disease. However, the severity of the disease, when you get a vaccine, that decreases the severity of the disease, or the length of day, the duration of the disease. That's what you should get it. It gives your body the weapon to fight the disease. Whereas if you don't have the vaccine, then your body does not recognize the disease, and the disease can kill you. That's why we have severe cases when we don't take the vaccine. The vaccine is there to protect, in the sense that it reduces the severity of the disease and then also decreases the duration of the disease. That's what we should have it.
Okay, great. What do you find to be most problematic about the idea of staff members suggesting that I'll wait and see how the vaccine plays out for other people before I get it?
Well, that is
entered any numbers. The meeting ID followed by pound.
that's always it's not a good idea, and it's a grave mistake to say that you wait to get the vaccine. The problem with that is when you get for a staff member, for everybody, if you end up with COVID, this is not about you, it's about the person next to you. So if a staff member, usually as a staff member with COVID-19, a staff member may be asymptomatic. Well, all right. A staff member may be asymptomatic, and then if you end up with the disease and then it lasts for longer, then you can pass it on to somebody else. So the vaccine again provide protection to people. I understand some people may have some reservation. However, it is always a good idea to get the vaccine so you get yourself protected. If you don't take it, then you don't get the protection that you need to get from it. So by saying that I'm gonna wait later to get it, but the other issue is COVID-19 won't wait for the next time. I mean, you don't know when you're gonna get it. If you're not protected, you're not doing a good service to yourself. You left yourself unprotected. So it's not a good idea. I think it's a bad idea to say I'm gonna wait for it because COVID is not gonna wait, and you never know. If you get hit by COVID, you never know which way it's gonna go with you. So some people don't have symptoms, some people do, some people die from it. So you don't want to take that chance.
Right. Okay, thank you. Is there a risk of a severe allergic reaction if someone does receive the vaccine?
Yes, there's always risk whenever you put a medicine, whenever you take a medicine, there's always a risk. However, the risk is less if you get the COVID, if you get the vaccine, the risk or the reaction is less than this getting the disease itself. You can treat those reaction. You can treat those reaction. You can treat those reaction, but you cannot treat COVID right now. We don't have a cure for it. So whatever you have from it, you may have a rash, whatever it is, you can take some Benadryl, whatever, we can treat it, but you cannot treat COVID. So the benefit of getting the vaccine outweigh the risk. So that's why we should still take it, unless it is a risk that, if you have a prior reaction. Well, I don't know anybody who have had it before, who has had it before. However, whatever reaction you get from the COVID-19, you can treat it, but COVID, you cannot treat it. So.
Wonderful. Okay, and with the vaccine being so new and produced rapidly, we often get asked, how can we be sure that this vaccine is safe? Because our staff members feel like it was rushed and it was pushed out so quickly.
Yeah, I've heard that. What people need to understand, COVID-19 is not something new. This has been discovered since, I think, since 1950s. At one point, there was research for a vaccine for COVID-19 for COVID. The problem is it was stopped. The reason it was stopped because there was no funding for it. So the data was still there. So you can always build on that data because people didn't throw the data away. Now, I don't think there's any way you read where it says that a vaccine should take 10 years, should take 5 years to get done. The vaccine, it has gone through the same step any vaccine would go through for approval. So there's no taking shortcut when it comes to the vaccine. So it is safe, although we're still looking for data. It just come out. We still should, just like any other medication, you follow it after it comes out. But there's nothing that says that that it should take 5 years, 10 years to get a vaccine. And there was already research on this, on the vaccine already. The data was already there. Some of it was already there. And the other good thing is it's a miracle that it's a good thing that we have a vaccine now, given the fact that more than almost 500,000 people have died in the United States from this disease. So if you say, okay, you're gonna wait for 5 years for another year, so the situation could be worse, given the fact that now you are having new mutant or variant of the disease. So it's a good thing to have a vaccine. It's not a bad thing, or it's not coming too early. There was data. There were data there already, and they have taken this step. All vaccines have to go through a certain step, and this vaccine has gone through the same steps. So.
Awesome. Thank you, Dr. Michel. Another question that we see so much, we know that we've been dealing with this since March 13th, and staff members say, well, I already had COVID. So, what's the point of getting vaccine? I already had it. I survived it. What's the point of getting the vaccine if I've already had COVID?
Well, I mean, it's a good question. I mean, we all know that if you get a disease, once you get the disease, so the body has antibody to fight it. But with COVID, what we have found that after a certain period of time, I would say about 3 months or so, a lot of people don't have the antibody anymore. The body, it's gone out of the body. So hence there's a risk of reinfection. So if it doesn't, the antibody, the protection doesn't last for too long. So after three months or so, you without protection. But when you take the vaccine, it depends. When you take the vaccine, then you have protection. I think now it's about a year or so. So that's why you should take it, because even if you have it after a certain period of time, the body would be without antibody. You are at risk of getting reinfected again. And even if you were okay the first time, who knows, maybe the next time you won't be okay because you get reinfected. You may have a worse case of it. So even if you had the disease, I mean, if you just had it, you can wait. You can wait. You have, I guess, you have the luxury of waiting, not getting it so fast. But I would recommend that after 3 months or so, you should, you should get it.
Okay. Now, can you get the vaccine at the same time as, say, another vaccine?
I wouldn't suggest that. This vaccine is new, so if something happened, you won't be able to know which is which. I wouldn't suggest taking them at the same time, because you may have if you have certain reaction from the vaccine, which is it? Is it the other vaccine, or is it the COVID-19 vaccine? So I would take it by itself, and I would wait another 2 weeks, or also to take another vaccine.
Okay.
I wouldn't suggest giving them at the same time.
Right. Nice. Now, for staff members that may be pregnant, wish to become pregnant, or breastfeeding, is it still recommended that they get the vaccine?
Yes, the American College of Obstetricians and Gynecologists advocate that they should get the vaccine. The only issue is it was not studied on pregnant women or lactating women. So, but they still recommend that they take it. Vaccine we know in general protect women, such as the flu vaccine or pertussis vaccine. Those protect pregnant women from those diseases. And we know that women with severe cases of COVID-19, they are at very high risk of comorbidities, and also having birth defect or pregnancy loss. So it is recommended that they still take the vaccine. It's not going to hurt them to take it.
Okay.
And and the other thing is, I'm sorry. The other thing is, it's not a live or infectious vaccine. So it's not gonna hurt them to take it.
What about the notion that, COVID is in the vaccine that we're being given?
No, COVID is not. COVID is not in the in the vaccine. I've heard that when people say that, you're gonna give me COVID, but it's not. It's just a particle of the disease that you get that would stimulate the body to produce antibody to recognize the COVID-19. But you don't get the disease when you get the vaccine. They don't give the disease to you. That would be terrible.
Right. Thank you. Okay. And after I get the vaccine, why can't we stop swabbing and testing, once or twice a week, or still wear PPE, still donning and doffing, still using N95s? Why is it important that once we get the vaccine, we continue to observe these protocols?
Yeah. So there are these right now, we don't have a cure for COVID-19. So the only protection we have against the disease is a vaccine. The vaccine is one way of curbing the disease, getting control of it. The second part is once you get the vaccine, that doesn't mean that you cannot have the disease. You can still have COVID-19. The vaccine only, like I said earlier, reduces the severity of the disease and the duration of the disease. So you can still have the disease. You can still pass it on. So you still need to wear the mask. Understand the vaccine only protects you. You may not die from the disease once you take the vaccine. It may not last for too long because you have the vaccine, but you can still have it. And for that period you have it, you can still pass it on to somebody else. So wearing your mask, your social distance, these are still behavioral things that we still have to maintain or continue to do to get control of this disease. You don't, the vaccine doesn't cure you. Just like any vaccine, if you take the flu vaccine, you can still have the flu. However, the severity or the length of it would be less. So that's the whole thing.
What about children? What are the recommendations for, getting your kids vaccinated?
The vaccine, I'm not sure. I don't think it was study for, I think they are starting to do study. They are starting to study them right now on children, study the vaccine on children. But I'm not sure right now if there's any recommendation to get them vaccinated, children vaccinated.
Okay. And for staff members that aren't vaccinated, what can they do now or continue to do to protect themselves from getting COVID?
Well, if you're not vaccinated, you still got to wear, the things that we've been doing: wash your hand, wear your mask, social distance maintenance. These are key. That's key for prevention. To minimize your risk. I would say to minimize your risk of acquiring the disease. Usually, yeah. So we still should continue those measures for not, for prevention of transmission of the disease, and then also for to prevent us from acquiring it. So if you're not vaccinated, you still need to wear your mask, wash your hand, and maintain your social distance. We should still do that. People should still do that.
Okay. And as a primary care physician in various parts of the city, what questions are you often asked by your patients about the vaccine for those that are considering moving forward with getting vaccinated?
Well, it's the same questions that you ask me. Particularly, I serve mainly African American or people of color. Those are the people that they are more full-time more likely to die from the disease than other group. There's a mistrust. The question is whether it's safe, or why should I take it? And there's a mistrust in the African American community or color community with regard to the health system. So there's always some sort of hesitancy. They would ask about safety. Also, they want some sort of reassurance in terms of whether they should get the vaccine. So mainly it's that hesitancy because of past experience with other experimental treatment.
Right, absolutely. And with different variants on the rise, how can we be sure or reassure that the vaccine protects us from those variants, especially since you can still get COVID despite being vaccinated?
Well, that is a good question. Right now, we have seen a decline in hospitalization rate of death and new confirmed cases because more people are vaccinated, and then also there are changes in behavior. However, those new variants, that's a threat. That's why a lot of people are concerned whether we are having control of this disease or those variants pose a threat to what could happen in the future. For example, I think in South Africa, they have stopped giving I think it's the Moderna vaccine because it doesn't either one of them, because it doesn't provide so much protection against the new variant. So, and it also in America, they say later on we can see more cases of the UK variant. So these are issues that, what can be done is, if you already have the vaccine, because they're concerned the vaccine do not provide enough protection against them. But what can be done is they can retool the vaccine. They can retool the vaccine to, maybe people may need to get another booster of the vaccine to protect against those variants. I mean, this is a new disease. Studies are being done. So, I mean, there's always a way to fight it. But they are studying those things. Maybe they may have to alter the vaccine we get now to protect against the new variant. Um, but the vaccine right now, there's concern that they're not providing enough protection against those variants.
Okay. Dr. Michel, thank you so much for joining us today. As I said before, this is recorded, so we're going to be pushing this out to the communities. We're going to be pushing this out to our administrators to share with their staff as we continue to get vaccinated and move forward with our second vaccine and our third vaccine clinics. Thank you for everyone that joined. And again, thank you so much, Dr. Michel.
All right, thank you. Thank you, Leah. It was a pleasure.